Good morning, everyone, or good afternoon, depending where you are in the world. My name is Sean Devlin, and along with Priyanka, we are from NHS Digital, and are going to talk to you today about our FIDO journey. So, as I say, I'm Sean Devlin. I'm a technical architect on the NHS App program within NHS Digital. I've worked in lots of different integrations and lots of different technical projects. But within the NHS App, when we started our initial journey, I had little native experience working with native apps on Android and iOS. And to me, this was a big eye opener, which we'll talk about later in the presentation. I'll hand you over now to Priyanka, who will introduce herself and give an overview of the NHS and the NHS Digital.
Hello there, I'm Priyanka Mittal. I'm a technical architect who works at NHS Digital and looks after both NHS Login and NHS App program. I've been with both the programs for more than 3.5 years. It has been a lovely journey working with both the programs. As per the agenda, today my colleague and me will be talking about our organization, the programs we work for, our FIDO journey, and our future plans. NHS is a medical and healthcare system which is publicly funded in UK. It is a more than 70 years old, well-established and world-leading healthcare system. NHS Digital, as the name suggests, is the information technology and data partner for NHS. Our motto is to harness the power of information and technology to make health and care better. Some key steps to emphasize the role NHS Digital plays in ensuring that the services are reliable, secure, and available. The numbers speak for themselves. NHS Digital Transformation Plan aims to digitize various aspects of healthcare, including primary care, secondary care at large, new care plans, patient engagement, and most important of all, to standardize the collection and publishing of data for research and oversight. NHS Digital has identified broadly 5 priorities to cover all the activities involved in our transformational plan. NHS Login and NHS App are part of Empower the Person. What is an empowered patient? A patient who has access to their medical personal information, which they can access or manage anytime from anywhere through the use of apps and wearables. Also, an empowered patient should have multiple channels of communication with their healthcare professional. There is an emphasis on preventive care. However, it's critical that this ecosystem of services is secure, reliable, and easy to use. This very well leads me to our next section of what is NHS Login. NHS Login is an authentication and identity verification service which enables people to access healthcare apps and websites securely using single identity credentials. We were commissioned by NHS to improve access to healthcare services and apps. Due to COVID, there has been a focus on digitization of services, and in last 18 months, we have seen a 10-fold increase in our user base. Currently, we support 25 million users, out of which 15 million users have got their identity verified to the highest level. Our vision is to provide a single process, not only for the people or individuals, but also for their nominated carers. In terms of standard and technology, what powers NHS Login, we have ensured that we use all the latest standards and market-leading technology. In nutshell, right, NHS Login offers convenience to its users, reliability to our integration partners, however, still manages a balance between security and ease of use. We want to create a brand where when a user sees continue with NHS login button, they can confidently access the service. At the moment, we have 45 other healthcare services live with NHS login. We have noticed an increase of 150% onboarding activity since the onset of COVID. NHS App happens to be one of our first partners and also one of the biggest partners of NHS Login. On this note, I will hand over back to Sean to continue further.
Thanks a million, Priyanka. And as Priyanka said, over the last 3 years, or just more than 3 years, the NHS App team has been working very closely with the NHS Login team to make sure that we both have a close together journey to make it easiest as we can for our users. So the NHS App is now available on the Android Play Store, iOS App Store, and a standalone web application for NHS users in England. It brings access to a variety of healthcare functions for patients in a single service. The app has a lot of core functionality. One of the main pieces of functionality that's brought a lot of spotlight in recent times is the ability to generate and view the NHS COVID pass within the NHS app. This is essentially the English version of a COVID passport for both domestic and international travel purposes. The app provides a lot of other core functionality, such as ability to book and view GP appointments, order and view repeat prescriptions, view your medical record, and access to other services. Some of those services are locally commissioned, so only available to certain people in certain geographical locations. So a lot of the services that are available within the app are available in other places, but the app brings them together in a single place in a single unified journey for all users. We really pride ourselves on putting users first and making an app that is accessible and easy to navigate for a wide audience. So in essence, our original mission was to allow members of the general public to fulfill their healthcare needs with a single touch of a button. So, and that brings us on to our FIDO journey, which began just over 2 years ago now. NHS login required two-factor authentication on every login due to the sensitive nature of the data that a user would see. So this would be a username, a password, user wait to get an SMS back, and then they can log in, and they would have to do this on every login. So this was the main thing for our initial user research when we first went live with the app. This was the main concern that our users had. So we had a large question: how do we make this process seamless for users? When we were thinking about passwordless login and how we would achieve this, we had a few key requirements. The first was to make sure that we use open standards. One of the open standards that NHS Login had decided to use from the start was OpenID Connect for authentication for users coming in and jumping between different services. And it was very important that whatever standard we use would play nice with that. We also wanted to make sure that it had easy onboarding for other services that came on to NHS Login, and they could easily use whatever that passwordless mechanism was, and it wasn't just tailored for a close coalition between the NHS Login and the NHS App. It had to be reusable in that format. So we very naturally gravitated towards FIDO. That wasn't really a big issue for us. There wasn't really any other alternatives that we could have went for. But we did have a couple of questions within that. So taking the clock back just over 2 years ago, the main question for us was UAF or to use FIDO2 or WebAuthn. Back then, WebAuthn was a lot more in its infancy. It didn't play as nice with native applications. So a lot of our users would have been using older devices. So we were sort of forced into using UAF, and that protocol worked out well for us. The next question for us was to build or buy. There were a few products available in the marketplace. We evaluated a few of these. However, we decided that they didn't necessarily fulfill our needs to be able to do this in a fully open way. So we took the challenge to build this ourselves with a view, which I'll mention later, of open sourcing this for other consumers of NHS Login or any other developers in the future that need to implement something similar with the UAF protocol. Basically, where we started with our implementation was eBay had a base UAF implementation, both the client, the FIDO client and the FIDO server available. The NHS App team went off and looked at how we would do the client side, and NHS Login looked at the server implementation. Essentially, from an NHS Login side, what this involved was taking that server that was there, hardening it up a little bit. It was then converted to use Python, which NHS Login uses, and deployed using AWS Lambdas, serverless architecture. So there did have to be some changes made, but a lot of it sort of fitted in nicely. The authentication flow is on this, as shown on the screen. Very much just follow the simple FIDO UAF authentication flow, where the user launches the app, makes an auth request, and when that auth request comes back with a message onto the application or the client application, that auth response message is sent using a special parameter in the OpenID Connect flow. So essentially, we were merging together the FIDO UAF flow and the OpenID Connect flow authentication, and that worked well and is a pattern that is used in other places. So from an NHS App client implementation point of view, we had different challenges on both Android and iOS. As I said before, we did base the implementation on the eBay version, although that wasn't fully productionizable. It was also using the Java language. We switched it to use Kotlin because that was the language that our app is written in. And we also made a few other changes to make it fit into the app. At the time, the Android biometrics API wasn't available. So we basically had to implement our own front end, and we had a lot of different UI complexity. Having went back in time and implemented this again in a different framework, that challenge is now gone with that biometric API that Android have created and released. We also found that when we brought this to production, the key store implementations caused us a lot of different challenges. So we did find a lot of production issues and failures that we didn't get testing when we were testing, because we weren't able to test in all the variations of device. So this was an interesting challenge for us once we went into production, and were able to fix those different issues, and actually had to change some of our flows to make sure that we could catch all the different scenarios that were possible. When it came to iOS, this one was a little trickier. There was no open source implementation available using Swift or anything similar for the FIDO UAF. So we had to look at making our own. Due to some of the low-level messaging that is required within the UAF protocol, we found this quite difficult to implement in Swift, which is a language which isn't exactly created for that low-level byte-wise operation purposes. However, after a lot of trial and error, we did get there. One nice thing about iOS was the fact that they had a very seamless interface for both Face ID and Touch ID. And from a developer point of view, we didn't really have to worry about what the UI looked like, and that took care of itself. So how did this change our user experience? Essentially, on screen is the login process before, basically 5 different screens where the user goes in, clicks multiple times, selects and enters multiple data items, and waits for a text message with a 2-factor authentication code and enters it in. On the next slide, you can see that then went down to a single screen or a single action, especially for Face ID is where it's more seamless. A very similar approach for Touch ID on iOS, and also fingerprint ID on Android. Our service performance, how that currently looks. NHS Login currently has 25 million users, a stat that has dramatically increased over the course of the COVID-19 pandemic. 15 million users have completed a high-level ID check within NHS Login, and this allows them to access that higher level data within the code, and that is where FIDO login becomes most applicable. 11 million users that have registered with NHS Login have also registered a FIDO device. And that sort of equates to about 500,000 FIDO logins per day. Beforehand, or currently, we pay 1.6p per text message to send the 2-factor authentication code. And at 500,000 logins per day, that equates to about £8,000 sterling that we are saving on SMS by using FIDO logins. I'll hand you back over to Priyanka to talk about the future and our current developments and how we're going to bring this forward.
Thank you, Sean. When you mention the future, right, it really excites me because NHS Login is growing at the rate of 150% in terms of additional services or partners onboarding it. And to meet or help them, what we have done is we have open sourced the code for iOS and Android client. We are in the process of open sourcing the server code. Also, as part of our onboarding process, we are emphasizing the biometric authentication. We are promoting our partners to implement biometric authentication. In last 18 months, our partners were focused on implementing digital services. However, given the success of biometric authentication, we are actively promoting the functionality of biometric login in NHS. Some of our partners have shown keen interest and are working with us closely to implement biometric authentication. So hopefully in near future, we will have more partners using this functionality and saving us a lot more money. In the end, right, I'll leave you with a quote from our program head, Melissa Roscoe, describing how biometric authentication has helped us. Thank you all. I hope it was helpful. Bye.
Thanks very much, everyone. Have a good day.